Now we move on to the first presentation. Dr. Srivastava will be talking about what is your talk? Field changes in automated Humphrey analyzer in tuberculosis following ethambutol therapy.
Yes.
Dr. Purva Srivastava.
Good morning, respected dignitaries. I, Dr. Purva Srivastava from Bhopal, would be making this presentation. The title of my presentation is Field Changes on Automated Humphrey Field Analyzer in the Tuberculosis Patients Following Ethambutol Therapy. A little bit about the introduction. The study was conducted to evaluate the visual field changes in tubercular patients on ATT therapy and to assess the reversibility of these changes after the discontinuation of the therapy. The primary objective of the study was to analyze the visual field changes following initiation and to also assess the regression and also if there is an improvement in visual acuity after the stoppage of the ATT. This study was conducted as a prospective analytical study at tertiary care centers in central India on newly detected tuberculosis patients who presented to us. Ocular history, relevant history was recorded. Detailed ocular examination was done at the time of presentation, that is before the initiation of ATT. Then all the patients were followed up periodically till the cessation of treatment and 3 months thereafter. The total duration of my study was approximately 18 months. So we had a total of 40 cases of newly diagnosed tuberculosis who were registered with us. The mean age was around 38.4 years. We documented a significant deterioration in visual acuity after 3 months of the initiation of therapy. And once the ATT was stopped, the improvement in visual acuity was statistically significant. That is 3 months after the cessation. And the p-value was less than 0.05, so which proves that it's statistically significant. Color vision and visual field effects were observed in higher proportion of eyes following initiation of ATT therapy, ethambutol precisely we are focusing on. And this also improved significantly after 3 months of the cessation of the therapy, p-value being less than 0.05. So my conclusion is that ethambutol, even in recommended doses according to DOTS program, has been associated with ocular toxicity which manifests in the form of painless progressive loss of vision, color vision defects and visual field defects. Though these changes are usually reversible, but in few patients we do have irreversible damage as well. So the patients who are receiving these therapies and who come to us for evaluation, they have to be explained about these probable side effects and they have to be warned about the periodic follow-ups. Follow-ups have to be mandatory. And these are tables that I made regarding the visual acuity and the field changes. So the major field change which I observed was central scotomas and centrocecal scotomas followed by peripheral constrictions and defects and peripheral defects mainly. After that, this is one of the Humphrey field chart of one of the patients showing centrocecal scotoma. Some of the references. Thank you.
So you have not done that your VEP and RNFL?
No, sir, in none of these patients.
Okay.
And your patients were all pulmonary cox, or there was some CNS tuberculosis also like meningitis, because then presentation could be there because of those aspects also.
So majority of my patients were pulmonary TB patients. Very few out of 40, less than 5 were extra pulmonary.
No, if there was any CNS tuberculosis, then I think you should have taken them out with this kind of assessment, because
Yes.
then whatever you are describing could also be there because of the tubercular meningitis or other factors which could give rise to neurological lesions. And you have had very high incidence, rather high incidence of toxicity. Any reasons you can think of why you had?
So most of the patients, they were coming to us in the government setup and they were enrolled with the DOTS center that we had, and compliance and not just with us, I mean with the pulmonary specialist also was very poor. So that's why I suppose.
So were they diabetic or any other systemic disease?
Yes, since the mean age that we had was 38 years and plus that. So yes, they had systemic complications. Some that were coming to us had diagnosed complications at DM and hypertension, and some they were not even aware of their status.
So they were not on dialysis or some kidney disease they were having, because
no,
in these
not-
patients you find
Yes.
more of ethambutol toxicity.
Because they add up to the clearing by the kidneys, you know. If the kidney
Yes.
functions are not good, then obviously the drugs are more in the circulation.
Yes.
Interesting study, and I think we need to analyze why you have had much higher
Much higher
incidence of
incidence. Yes.
toxicity. Thank you so much.
Thank